Here to keep us updated and keeping check of our heart health is Dr. Shoba, who is going to be explaining a term we've all heard before, AFib. Dr. Shoba, thanks so much for joining us on Daytime. AFib, a lot of people hear that word, a lot of people do not know what it is. So can you explain it for us?
Sure. AFib is a type of irregular heart rhythm.
Okay.
Normally our heart is very, very rhythmic. You know, the upper chamber squeezes and the lower chamber squeezes, and our heart beats beautifully, you know, about 50 to 100 times a minute. But in AFib, what happens is the upper chamber just beats all over the place, very, very irregular, and the lower chamber tries to keep up with it. So you can have a slow heart rate, you can have a rapid heart rate, you can have a very irregular heart rate. Mm-hmm. The bad side is some people don't even know they have AFib. And so there could be people walking around and have AFib and not know it.
Mm-hmm. Sorry, go ahead.
But some people will have symptoms like shortness of breath, palpitations, they feel tired, they can actually feel their heart pounding, they get dizzy, they get lightheaded, and some people can have significant chest pain just like they're having a heart attack when the heart goes into AFib.
Yeah. And so what are the dangers of having AFib?
The biggest danger of AFib is actually a stroke. As I mentioned earlier, the upper chamber kind of just wiggles around like this and doesn't squeeze normally, so the blood just collects in there and stays stagnant, and the blood can clot. And then all of a sudden, when it squishes, the clot gets up, goes to your brain, and can cause a stroke.
Wow.
So that is the biggest danger. Of course, there are other dangers to AFib, because you can sometimes have congestive heart failure worsening when you have AFib.
And so we talk about the kind of irregular heartbeat. What about normal heart rate and low and high heart rate? I mean, there's so many different things that you need to kind of keep track of, right?
Right. Normal heart rate is anywhere from 50 beats a minute to 100 beats a minute. When the heart rate is lower than 50 or less than 60, you call that bradycardia or slow heart rate. And when it's higher than 100, you call it tachycardia. And under normal circumstances, when you're active, your heart rate will go up. When you're stressed or emotionally upset, your heart rate is going to go up. That's just normal tachycardia.
Right.
But in some people, you can have abnormal types of tachycardia where the heart rate goes up to 200, 300 beats a minute. And there is some sort of an electrical short in the heart where the electricity just zips up and down. And some of those patients can actually be treated with a procedure called ablation, where you can go in there and zap those areas with electricity so it permanently goes away.
Wow. And so what are some of the causes of either low or high heart rate or even AFib?
Right. There are a lot of different causes of AFib, and I must throw in a little bit called PVCs in there. A lot of women have that. You know, PVCs are skip beats or extra beats from the lower chamber of the heart.
Okay.
PACs are extra beats from the upper chamber of the heart.
Okay.
Now, all these rhythm problems are because of an abnormal electricity in the heart. Now, if you have an abnormal plumbing in the heart, like a clogged artery, you have heart attacks. When you have abnormal electrical problems, you have AFib, you can have cardiac arrest where the heart stops. So different situations.
Right.
The causes of AFib or extra beats are actually oftentimes things which we do to ourselves. You know, you're stressed out, you've not slept at night, you're drinking a lot of caffeine, you're drinking the sodas, you've got a headache, you're taking some ibuprofen. All these things can actually throw you into AFib or have skip beats or extra beats.
Wow.
The other common cause actually is alcohol.
Wow.
And some people will go on binge drinking and not drink. They can, and that condition is actually called holiday heart syndrome when your heart goes into atrial fibrillation.
Because you're drinking too much.
And there's the other common causes are some of the medications you're on. Suppose you have COPD or breathing problems and you're using a lot of inhalers.
Right.
You're taking cough or cold medicines, that can also throw you into AFib. Remember caffeine, you know, too much coffee, too much chocolate, green tea.
Right.
All these things can cause rhythm problems in your heart. Sleep apnea is a big one, and high blood pressure. If you're not breathing good at night, your heart does not get enough oxygen, you can have rhythm problems.
Okay. Wow. So many different causes. And real quick before we go, last question. If people, you know, maybe are experiencing something that's going on, doesn't feel right, what do you suggest for them to do?
I think you should first go to your doctor and get it checked out. If it's an emergency, you need to go to the emergency room. You know, low potassium and low magnesium electrolyte problems can cause this. And these days there are fine apps. You know, there's if you have an Apple Watch, you can have a band called the Cardia, or even off a cell phone, you can have an Alive Cord. That's an app that you can download, and you can actually look at your EKG yourself.
Wow.
And so it's like a $99 app.
And it's well well worth
and
it.
it's well worth it, absolutely. But you know, very important to contact your physician if you are having rhythm problems.
And just get checked. All right, Dr. Shoba, thank you so much. We so appreciate it. Some great advice right there. And if you want some more information on staying heart healthy, just look at the bottom of your screen.